child's eye development happens when a child is less than 7 years of age. So, it is important to know what level of vision is normal for your child. In this video, I will discuss normal visual behavior of children and how you, as a parent, can assess this at home. Should a child have no visual problems, vision should be screened regularly a week after birth, 3 months, 6 months, 1 year, 3 years, and 7 years of age. Let's start with newborn babies. At birth, a baby will start to use his eyes to see the world. A newborn baby should open the eyes within a day of birth and respond to bright light. To check vision, use the light from the phone to look at the baby's eyes. Just shine for less than a second to make sure you don't dazzle the baby's eyes. A normal baby should blink in response to the bright light. Once a child is 3 months of age, the child should start to recognize the mother's face and start to follow light, faces, and moving objects. To check vision for a 3-month-old, look at the child and see if the child looks at your face. Then, use big toys and see if the child will follow the toys. A child with normal vision will be able to fixate on your face and the eyes will follow moving toys. At 6 months of age, the child should be able to pick up toys and play with hanging toys. The child should be able to see objects as small as a 4x4 stud Lego brick. To check vision, place a Lego brick on the table and see if the child will grab the Lego brick. If the child can grab the brick, the child can see the object. Just make sure the child does not try to swallow the Lego brick. Besides checking if the child can see, we must also assess if vision in each eye is equal. First, make sure the child is looking at something interesting, like a toy. Then, occlude one of the child's eye with a hand and see if the child cries or objects. Repeat the process with the other eye. If the child does not object to occlusion of either eye, vision is about the same in both eyes. At 1 year of age, the child should be able to pick up small objects and appreciate fine details on objects. To check vision, you can use sugar sprinkles. Just sprinkle the sweets on the hand and see if the child picks up the sweets. A child with normal vision should be able to pick up the sweets. At 3 years of age, a child should be able to run and hop with minimal falls. The child should also be able to do simple art projects. To assess their vision, observe if the child squeezes their eyes or adopts abnormal head posture when viewing distant objects. Then, hold the book at arm's length and ask the child to close one eye. See if the child can appreciate fine details such as small letters or faces. Repeat the procedure with the other eye. A child with normal vision should be able to see small details equally in both eyes. Once the child is able to appreciate numbers or letters, you can check the visual acuity using a DIY visual acuity chart. Details on how to make it can be found in my previous video. Vision in a 7-year-old child should be like an adult, where the child should easily be able to identify road signs and distant objects. Vision can also be checked with the DIY visual acuity chart. These visual screening techniques are only a gross estimate of a child's vision. If your child has poor vision, it is best to see a pediatric ophthalmologist for a full eye assessment. This concludes our video for today, and if you have enjoyed it, please remember to like, subscribe, and share. Thank you!